Welcome back, everyone. My name is Yusuf Farrell. I'm a pharmacist in the United States, and today we are continuing our series on every birth control available in the United States. Last time we talked about the birth control patches and birth control rings. Now we're going to talk about injectable birth control. So far, with all the options that we've discussed, with the pills, the patches, rings, and the spermicides, while they're all highly effective and very commonly used options, the one you could say limiting factor about them is that they're short term in terms of how long they provide their contraceptive and birth control activity, at most being only a month at a time. Even with Anovira, it has to be taken out every month, and you can't just leave it in constantly. Now we'll start to discuss some, more longer-lasting options that can be preferable to patients who really just want to just kind of take a medication and forget about it completely, right? The first option that we'll discuss is the only injectable contraceptive available, and that is Medroxyprogesterone, or MDPA for short. Comes under a few brand names. There is Depo-Provera. You got also like Sub-Q Provera, for example. I'll give a little disclaimer. MDPA does come as tablets, but those are meant for other conditions, such as abnormal uterine bleeding, for example. The tablets are not meant as a contraceptive option. So for this video, we'll only be discussing the injectable version of MDPA. So what is MDPA? It's a progesterone derivative, and it works the same as all the other progesterones that we discussed. It works the same as levonorgestrel, as ethinylediol, norgestimate, etc. The thing is about MDPA is that when it is injected, it actually gets absorbed a lot more slowly compared to the other progesterones. And because of that, it works for up to 3 months or 14 weeks. It makes it a very attractive option for those that prefer a non-daily, long-lasting contraceptive. So the drug can be given either as a intramuscular injection or subcutaneous injection, IM or sub-Q for short. A IM injection would be injection given kind of more deeply into the muscle. Sub-Q would be more into the tissues right before the muscle. The dosing would be different depending on which route the patient is aiming for, but the effectiveness is still the same. And so while it may seem like this is a very nice option for patients where they could just take one injection and it lasts for 3 months and they don't have to worry about anything, there are some downsides. So the first one is that the medication must be dosed continuously to provide protection. So again, like we mentioned, it lasts for 12 to 14 weeks, but it has to be dosed every 12 weeks to continue having its function. So if a patient, for example, misses a dose, they could lose that protection. The second thing, though, is that because of the long-lasting nature of the drug, if a patient decides to get off of this birth control and to try to start having a family, for example, it can take a few weeks until fertility returns. So that's something that you do have to warn patients about, that fertility just doesn't return right away. It can take a few weeks for that to happen. The third thing is that MDPA can actually cause weight gain in women. So from what I've read, and what the package labeling says and what the studies I've read have said, patients can expect to gain up to 8 pounds, but that's only if they've been using it for 2 years. That can be a big turnoff for patients, but also keep in mind that MDPA is not really recommended to be used for more than 2 years, and we'll discuss that a bit later. The next thing is that the dosing, the first dose has to be given at a very specific time. So it has to be given within the first 5 days of the normal menstrual period. So whenever a woman's period is, it has to be given within those first 5 days. It can also be given within the first 5 days postpartum or after birth if the mother is not breastfeeding. And the final thing that patients do have to keep in mind is that the medication can cause bone loss due to the reduced production of estrogen. And in fact, this is a black box warning on the medication. It's been like that since 2004. So the mechanism behind that is that the MDPA will actually cause a decreased production of estrogen. And estrogen actually plays a role in bone formation, bone like buildup and production. So by decreasing the amount of estrogen, you could make it that a patient's bones do not grow as much, and they're weaker, for example. So because of that, it's actually MDPA is not recommended for very young patients who may still be growing or who have not like fully gone through puberty yet. So think like patients within their teen years. It's also not recommended to be used for more than 2 years because of that, because the risk of bone loss increases as the patient continues using the medication. It can be argued, from what I've seen, that the risk of bone loss has been overblown, but it does require more research into the topic. It's something to keep in mind, and if a patient does want to use it past 2 years, it has to be a discussion between them and their healthcare provider regarding the risk and benefits. And then, in terms of failure rate, it has a failure rate of 6%, which is better than the other options we mentioned before. So that means out of every 100 women using MDPA, you can expect around 6 to become pregnant even while they're still using it. Otherwise, it's a very similar progesterone to all the other ones. Okay, thank you guys all so much for watching. Hopefully with the next video we will be covering IUDs, which is a very interesting class. Anyways, please like, share, subscribe. Please comment on the video. Let me know what you liked about it, how I can improve. And I'll see you guys all next time. Thank you.